Hey everyone, and welcome back for another deep dive. This time, we're digging into something I'm sure you've heard a lot about lately. Tirzepatide. It's this weight loss and diabetes drug that's been all over the news lately, and not always for great reasons.
Yeah, you're right. It seems like every day there's some new development with Tirzepatide, some new twist or turn.
From shortages to lawsuits, different versions of it popping up, the FDA making decisions, it's a lot to keep track of. But don't worry, that's why we're here. We'll unpack it all.
Exactly. We'll break down everything that's been going on so you can understand what's really happening and, most importantly, what it all means for you.
Perfect. So let's start with the basics. Tirzepatide, right? It's the drug behind brand names like Monjaro for diabetes and then Wegovy, which is for weight loss. It's been called a real game changer, hasn't it?
It has. It's part of a newer class of drugs, these GLP-1 receptor agonists, and basically they work by acting like a hormone that helps your body manage blood sugar. And a nice little bonus is that it can help people lose weight too.
Which explains why everyone's talking about it. But, with all this popularity, seems like there have been some shortages.
It's true. It got so popular that the FDA, they actually put it on their official drug shortage list back in December of 2022.
And I'm guessing being on that list is more than just a small inconvenience. What does it actually mean for people who need this medication?
Well, to start, it just became a whole lot harder to find. Like, imagine going to your pharmacy and they tell you the medication you depend on, it's gone, out of stock, and they don't know when they'll have it again.
Oh, I can only imagine. Especially if you're dealing with something like diabetes. That must be so stressful.
Absolutely. And this is where it gets more complicated because this whole shortage situation, it kind of opened the door for these things called compounding pharmacies or outsourcing facilities.
Okay, yeah, I've heard of those, but honestly, I'm not entirely sure what they do.
So picture this.
Huh.
It's like a pharmacy, but instead of just giving out the pre-made medications, they actually create custom formulas based on what your doctor prescribes.
Oh, so they're like the, what's the word? Bespoke tailors of the pharmacy world.
Exactly. They can adjust the doses, change a pill to a liquid if you need it, even take out ingredients for people with allergies.
Okay, so I get how they could be helpful during a shortage. But that also sounds a little risky.
Yeah, that's the big question, right? And it's a big part of this whole Tirzepatide debate. See, these compounding pharmacies, they can be super important when there are shortages, but they aren't held to the same super strict safety and effectiveness standards as those huge drug companies.
So it's like, on the one hand, you have people who really need this medication, and suddenly they can get it, often for less money, thanks to these compounded pharmacies. But then,
But then on the other hand, there's the question of how good are these medications, really? And that's where the FDA and Eli Lilly, the company that makes Tirzepatide, they enter the scene. Because this isn't just about people getting their medication, it's also about money and who gets to control that market.
right, and that takes us to all the recent back and forth with the FDA and whether there's even still a shortage, right? It's like a drama unfolding in real time, and, well, Eli Lilly, they're definitely playing a part.
Yeah, let's just say they haven't exactly been quiet about protecting their turf.
So tell me more about the FDA changing their mind. What happened there?
Well, it was just a few weeks ago, the FDA, they said the shortage was over, like totally over.
And I bet Eli Lilly was pretty happy about that. Less competition.
Oh, definitely. But here's the thing, the OFA, that's the Outsourcing Facilities Association, the group that represents these compounding pharmacies, they weren't going to just sit back and let it happen.
They took them to court over it.
Yep, filed a whole lawsuit. They said the FDA just took Eli Lilly's word for it, that they didn't actually check if the shortage was really gone.
Well, Eli Lilly wants to sell their version, right? Makes sense. It'd say there's no shortage anymore.
Right. But what about the people who need the cheaper option, the compounded one? That's what the OFA is arguing about.
That's a tough one. Because the FDA, they have to make sure all the medications are safe, right?
Yeah, that's their job. And let's be real, those compounded medications, they don't always go through the same super strict process as the big companies' drugs. There's more room for things to go wrong.
And Eli Lilly, they've been talking about that a lot, right? Saying these compounded versions might not be safe.
Oh, yeah, they have. They've been saying they found stuff in some of the compounded Tirzepatide, like it wasn't made right.
Oh no, like what? What did they find?
Well, they said one of the products was basically just sugar alcohol.
Sugar alcohol. Seriously. Wow. So someone's getting their sugar fix, but not their diabetes medication.
Exactly. It's kind of funny, but also kind of scary, right? That's what makes this whole thing so complicated. Cheaper meds sound great, but are you really going to risk it when it comes to your health?
That's the question. Okay, so Eli Lilly is saying one thing, the OFA is saying another. What did the FDA do? Did they side with Eli Lilly? So they changed their mind.
Yeah, for now, anyway.
Really, what happened?
Well, the FDA, they said, okay, for now, compounding pharmacies can keep making their version, when we look into all this.
So
But
the people who need the medication, at least they can still get it.
exactly, that's the idea. But it definitely throws a wrench in Eli Lilly's plans, I'm
Yep,
sure.
for sure. They're not too happy about it, I bet.
Not at all, no.
Yeah.
But it's tough, right? Because it all comes down to how much risk are you willing to take to save some money? That's the real question here.
It really is. So for people listening, what should they do? I mean, if they're thinking about taking Tirzepatide, any advice?
Talk to your doctor. That's always the
It's
first.
always good advice.
Yeah, your doctor can help you decide if it's even right for you, you
Yeah.
know, and let's talk about, like, what are the downsides? It's not for everyone.
No, definitely not. So say Tirzepatide is right for someone, then what? How do they choose which kind to take?
Well, that's where that talk with your doctor is super important, right? Because on the one hand, that compounded version, it could save you a lot of money,
Mm. Especially if you don't have good insurance or your deductible is like $1 million.
Exactly. But are you willing to take that risk? Because the FDA, they make those big drug companies go through a lot of hoops for a reason.
Yeah, to make sure the medications are as safe as possible. So how do you know, I mean, how can anyone be sure the compounded stuff is okay?
That's the thing. You can't always know for sure. That's why talking to your doctor, it's so important. They might even know, like, oh, this pharmacy has a good track record, things like that.
It's really complicated, this whole thing.
It really is, and it makes you think, about the bigger picture, like how much do medications cost? How easy are they to get? It's bigger than just this one drug.
That's a good point. Well, we've learned a lot, that's for sure. As we wrap up this deep dive, anything else you want to leave people with?
Just be informed. Ask questions.
Yeah.
Don't be afraid to speak up. It's your health. It's important.
Couldn't agree more. Thanks for joining us for another deep dive. We'll be back next week with another topic, but until then, stay curious.